Good afternoon, Roxy Soxy.
Good afternoon, Tam Tam. Here we are in the OC.
I feel like I'm on the Today Show.
Don't you?
I feel like this setup is a little bit like we're in like studio.
Yeah, it's like it feels really nice. There's like a
really
warmth.
nice.
There's like a
Yeah.
very professional kind of feel.
So
I
we
like
can't
it.
screw it up. I mean,
No.
we can try, but
No.
hopefully
No.
you will lead the charge.
I will take us to the finish line. Is that okay?
I would like you to take us to the finish line. I don't even know if I've started at the starting line. But today I was, we talk so much about mental health on our show, Women on Top, and I was actually thinking recently of taking, I don't know if I've said this to you or on the podcast, about taking medication, like actual medication, because I've always been anxious. I've had anxiety disorder most of my life. I had PTSD. I was a child actor. Boo-hoo. People are like, that is not trauma. I'm like, it is very traumatic. And I've tried everything, and I've still got that last little niggling bit of anxiety that is just still holds me. And I was going to actually reach out to our next guest, like privately, to see what I should do, but why not just tell the entire world and millions of people? But I was going to ask him what his thoughts were on that, because he understands the brain better than anyone I've ever met. Have you ever suffered from mental health issues or mental illness?
I don't know if it's, I guess it would be kind of maybe a form of OCD. I mean, I have very much, like, I have a little germophobia, right? I like to wash my hands a lot. My hands show it because they're very dry.
Yeah.
But I think I do have anxiety at night when I'm kind of trying to go to sleep. Yes, the death anxiety. Have health anxiety. Just worrying about illness and sickness. My dad's a doctor, so he's an oncologist. So I don't know. I've kind of always grown up around like talking about health a lot, but in a very negative way sometimes. So I think there is little bits of that also kind of plague me. And I've never had it formally tested, but I probably should, just to know at this point.
I'm sure.
Exactly.
There's something there.
Yeah, there's something there.
But do you drink, because I actually stopped drinking recently for my mental health, and I used to actually drink for my mental health, thinking that it helped with my anxiety and my dopamine, but it actually does the opposite, and we can ask our guest that too. But do you find yourself ever drinking because you're stressed or anxious, or do you have a drink because you're celebrating?
I think it's both. I mean, obviously there are celebratory times, there's big momentous occasions, weddings and birthdays and things like that. But I do find that, like, come the end of the week, like on a Friday, if I've been, working and I'm stressed and I'm tired and, all the mom things too on top of it, and dealing with husbands, I mean, all of it, right?
Husbands will make you drink.
They send you to the bottle. But I feel like sometimes come Friday, like that's usually like the time when I want it. Like that's like the end of the week, my work is like pretty much done for the most part, and I just kind of want, like, especially in the summer when it's hot, like a cold margarita to go with some tacos. But
it's what are we gonna do with you?
It's hard. It's hard, and I'm also from the South. I'm from Texas, and that's kind of what we do there. But it's hard. So I mean, I should probably find other outlets for that.
Yoga,
Pilates.
It was fun.
Reading a book, But yeah, so it'll be interesting to see. I'd like to delve into that a little more.
Well, our next guest, I actually had my brain scan from him just after I gave birth, and that was probably not the best mental health situation that I was in post-birth. His hormones are going crazy, and I was really nervous because I had to, there's this dye that's I think it was it injected? It was injected. They gave it to me.
It's not a dye.
It's not a dye, and he's gonna tell me that. But I had to finish the story. I was so nervous that I almost didn't come because of the dye thing, and it wasn't because I was nervous. My mom, love her, love you, mom. She has freaked me out about any substance going into my body, so I've never taken drugs because I'm so freaked out by them. And so I was almost not gonna come because it's not a dye. But it helps you see your brain in your brain scans when they do the scan of your brain to see what's going on in there. And he made me feel so at ease about it, and I was like, screw it, I need to know what's going on with me. So I came, and we did a lot of other tests too, but we can talk about this in the podcast. And who do we have? Roxy Soxy.
Well, we are so excited to welcome him back. He's a medical expert. He's a doctor. He's really put mental health and taking care of your mental health on the forefront. His social media has absolutely exploded in the last few years. It was amazing.
All of us combined, he has more followers.
I know. We need to take some lessons from him.
I know.
So please welcome back to the podcast. He's a friend of ours. He's been a guest with us before, and we're just so grateful to have him. Dr. Daniel Amen. Welcome.
Thank you so much. It's so great to see you both.
I know, in person.
Yeah.
In person. Where we can hang out.
I was going to say, has my brain changed? Have I changed? You're like, I need to see your brain to know if your brain has changed.
Yes.
You know, what a concept that we should actually look at it before we go about changing.
Yeah. So I want to ask first and foremost, like, what do you, so the new people who are listening who don't know about you, what do you do differently than other people who help clients with mental health? You know, this brain scan that we did has never been offered to me before in trying to figure out like what's going on in there. So what is different when people come and they see you and they want to figure out like what's going on?
So I'm a child and adult psychiatrist, and most psychiatrists never look at the brain, and that's insane. It's like, how do you know unless you look? Psychiatrists are the only medical doctors that never look at the organ they treat. And when I decided to become a psychiatrist 44 years ago, because someone I love tried to kill herself, and I've loved being a psychiatrist, but it's like, well, why aren't we looking at the brain? Obviously, the brain is our organ. And it's like, oh, we don't do that. And I was sort of a pain in the neck teenager, if you ask my mom or dad. And I'm like, no, we have to do that. And so for the last 32 years, we do a study called brain SPECT imaging. SPECT looks at blood flow and activity. It looks at how your brain works. And what it taught us is most psychiatric illnesses, anxiety, depression, bipolar disorder, schizophrenia, PTSD, whatever, are not mental health issues. They're brain health issues. If you get your brain healthy, your mind will follow. And some big lessons we learned is alcohol is not a health food. It's not good for your brain. It makes your brain look older than you are. So the fact that you stopped, I'm so happy.
I didn't drink a lot to begin with, but you helped me through that too, because I was like, why am I even having 2 a week?
Right, is we celebrate by hurting ourselves. That's a little weird, right? It's like drinking a disinfectant, probably not a good idea. But you know, without imaging, how would I know that marijuana is not innocuous? It prematurely ages the brain. Alcohol's not innocuous. It's not a health food. Let's stop lying about it. You probably shouldn't let your kids hit soccer balls with their head. Brain is soft, skull is hard. Skull has sharp, bony ridges. And so what's really different is we're going to look at the organ, your brain, and then target our treatment. Yes, we have to get to know who you are, right? And then you've heard it said, a picture's worth 1,000 words, but a map is worth 1,000 pictures. A map tells you where you are and gives you direction on how to get to where you want to go. And so I have a map of your brain, and if you're still spinning on things, you get upset and you just can't let it go, and it does this little reboot thing, then we need to raise serotonin, and that's the pattern we see in your brain.
Interesting. So what is, not to just violate HIPAA right now or anything, can you tell us Tammyn's diagnosis and what you recommend?
It's fine. It's fine.
What did you see?
I think I've told all of social media, so it's fine. What do you see in my brain, doctor?
Yes.
So it was...
I'm going to use this to your advantage. I know you are.
Give me all
things. There was 3 things. That you have ADD. It's not a big surprise when you take your history, right? And you had low activity in the left front part of your brain. But I wrote a book a long time ago called Healing ADD. It's like, it's not one thing. It's 7 different things. And one of the most common types is what I call over-focused ADD, where the problem is not that you can't pay attention, but you can't shift your attention. And if you can't shift your attention, you can't pay attention because life is always shifting. And so you end up locked onto things, stuck on things, same thought in your head over and over. And we saw that in your scan, where it's an area called the anterior, that just means toward the front, cingulate gyrus, works too hard. And so if I find a way to raise dopamine to help the ADD and serotonin to help you shift better, that's good for you. But then I saw something called Irlen syndrome, where you have a visual processing issue where lights bother you. They actually send interrupt signals to your brain, and that all by itself can give you ADD and make you anxious.
So I have, most of my panic attacks or anxiety attacks happen in the grocery store. And it's because when I walk into a different situation where the lighting is different, I can't cope. It happens almost instantly, and I find that leaving Los Angeles, I've had less anxiety, not because of Los Angeles, because it's a very anxious city, because it's always bright here. It's always sunny. There's never clouds. And when the days where it was gloomy, I actually feel the best. I actually feel the most calm. I'm actually able to get through things. And Nashville has a lot of moments of cloud and storms, and so I feel better in Nashville than I do in Los Angeles. So I definitely have a life.
So I need you to follow through on
Yes.
that recommendation.
I have ADHD, and you're asking me to follow through.
I know, but you were early today. So
Yes.
I love that.
I'm pretty good with time.
You are good with time. It's true. It's true.
Irlen, IRLEN.com. You get screened, and then what you end up doing is you wear, and you're a star, you end up wearing colored filtered glasses. And the world changes for you in such a positive way. And the first time I heard about it, I thought it was nonsense because I didn't learn about it in school. But I've literally had thousands of patients get great benefit from being diagnosed properly and wearing the silly glasses. Makes a huge difference because the light that's bothering you is constantly sending interrupt signals to your brain. And you go to therapy for like 30 years and like clean out the whole emotional closet, but it still won't make you feel better.
What about being an actress, though, when you're on set
Yeah,
and
because
there's
all the
so
lights.
much light?
Yeah.
It's hard. So
Hard.
they make contacts. And so you could just pop in the
My
contacts.
life is going to be so much better.
I know, but I want you to do what I want you to do.
I know.
There's, I don't know if you've seen the new docuseries, Stutz. Jonah Hill did a whole series
Yes,
on his
yes.
psychiatrist, and I loved it. I thought it was really good, and I stole one of the lines from it because Dr. Stutz said he tells his patients, just do what the fuck I say, and you're gonna get better. And so I'm like, do what I say.
You can put a fuck in there. That's fine. Do what the fuck I say. I will listen to you. You're the only doctor I really...
Because I'm here for you.
Yeah.
Yeah, no, that's actually really good because so much of the time people don't take, what doctors say and do what they're supposed to do. And especially if it's a habit. So like we were talking about drinking a little bit, right? And
Let's
it's
talk
something,
about drinking.
right? That you were kind of, something that you enjoy. I feel like in Hollywood now especially, you go to some of these dinner parties and, not only is the alcohol flowing, but there's microdosing happening. People are bringing out chocolate mushrooms or gummies and all these kinds of things. So is there a lesser than, perhaps less dangerous for your brain substance? Is there something that's milder and doesn't affect it as much? Or is it just all bad?
Well, if we're looking at marijuana, alcohol, mushrooms, they're all bad.
Okay.
Right. I mean, the most common question I get now is on psilocybin. It's like,
Yes.
oh, they're using it for PTSD. And,
Right.
well, maybe if you failed like the first 12 normal things to do. But it also disrupts people. And people have bad effects from them. I want you to just ask yourself this one question. Whatever I do I love it? And does it love me? Right? I don't know if either of you have been in bad relationships, but I have. I was married for 20 years to someone who didn't like me. And I'm not doing that anymore. It's like, no, I'm not okay with this. I want to have a good relationship. And I for sure want to have a good relationship with food. I for sure want to have a good relationship with anything I drink, right? Or anything I put in my body. So do I love it? And does it love me back? Because ultimately at the end of the day, what do you really want? Energy, memory, connection, passion, purpose. Alcohol doesn't help any of those. Mushrooms really don't help any. They're something that makes you feel better fast, but never lasts. And I want to do things that help me feel better fast, that last. Like we were talking about at night before you go to bed and you feel anxious. I have this exercise I love, which is what went well. So I say a prayer, and then I go, what went well today? And I start at the beginning of my day. And I just go hour by hour. I put myself to sleep with what made me happy that day. And the bad stuff shows up, and I just imagine a big room and sweep it away. Not the point. Focus on what you love. And it's a great exercise for the kids. Like at dinner time, or you're putting them to bed. Go, hey, what went well today?
Yeah.
And then every fifth night go, what went weird today?
We do our I can't
Roses
remember.
and Thorns?
Yeah, we do what went well and what didn't go well and how we could make that better. But I want to talk about alcohol because I do think that alcohol is like the only real drug that's like so accepted pretty much most places in the world, and people push alcohol on you a lot and they feel very uncomfortable when you're drinking, because I haven't drank for a year, and when you're around people who are drinking when you're not drinking. But I think for people to understand why alcohol isn't great, I think it would be great to talk about what it does to the brain. Because I think it's really easy to be like, alcohol is not great. I feel like at this point in 2023, we know it's probably not great for us because we know how it makes us feel afterwards. But what does it actually do to the brain and dopamine? And what is dopamine for people who never even heard of it? And how does it affect it?
So dopamine is a neurotransmitter that works on a lot of your brain, but it works on the pleasure centers in your brain. And it's involved with focus, motivation, pleasure, drive. And those little pleasure buttons in your brains called the nucleus accumbens, if you hit them too hard or too often, you wear them out. And then pretty soon, like you were a child actress and you had a lot of fame, and fame wears it out. So fame is a dopamine hit, and it pushes on those pleasure centers, and then if it's too much or too often, it begins to wear them out, and then you feel sad.
And then you search for it, right?
No reason. You feel sad, you feel flat, you feel unmotivated, you feel depressed, and then the vulnerability, and we've seen this in Hollywood forever, is addiction. And they develop addictions to things that increase dopamine. Not so they feel high, but so they feel normal.
That's what I said to Sean, my husband. I was like, I have one glass of wine, or when I did, just to feel normal.
Right.
Just to feel calm.
And so now we want to protect your pleasure centers so you can feel happy all the time. And that is avoid things that dump dopamine. So alcohol, marijuana, psilocybin, they dump dopamine and do things that trip dopamine. Like I saw a hummingbird this morning, totally tripped dopamine, right? Didn't get crazy, or where I live, I heard the seals barking, and I'm like, yeah, I love that. But it didn't go overboard. And overboard is where we're at in our society, which is one of the reasons mental health challenges are so prevalent. Whether it's alcohol or pornography, another thing.
The phone I feel like is ruining my life. I think I need to go
social media.
To a detox. I actually need to go to a place. Honestly, I believe this is probably one of the most honest, vulnerable things I've ever said. not for alcohol and drugs, but I am 100% addicted to my phone, where I believe that it has affected my relationships probably with my family, even though I'm so close to my kids and my husband. But I can't wait to get on my phone at the end of the day. Like I need it. The first thing I wake up in the morning, I need it. Like I search for it, and it's an addiction that we've normalized in our society, and we're like, everyone's on their phone and that's okay. It's actually not okay. When I went to Bali in Indonesia, no one's on their phone, and I don't know if it's just a cultural or they're with each other. They seem so happy. They're playing. Their kids are running around, and they're all us, like the tourists, constantly looking at our phone while we're in Indonesia, like instead of looking out. And it's a huge problem, and I'm finding an addiction on me, and I'm worried about my kids because I know that they look at me, and my daughter even says, you're on your phone. It's unfortunate because the phone's also a camera. It's also a way to get driving directions. It's also a way to search like where the local gas station is. So it's not just social media. It's everything in the palm of our hands, and I think it's a problem, and I don't think it drips dopamine, right? It gives you a hit of it.
It hits it, yeah.
Right.
Every time it buzzes, every time it rings, every time you get a notification, and it wears out your pleasure centers over time. People spend the most time on their phone, have the highest incidence of obesity, because they're not moving, and depression.
And then we feel like...
And on average, so with things, just social media is a side note to the phone. On average, American kids and young adults spend 3.5 hours a day on social media. If you are more than 3 hours a day, your risk of anxiety and depression have just gone up. No wonder we're in this epidemic of anxiety and depression for young people. 57% of teenage girls report being persistently sad. That's horrifying, right? 24% have planned to kill themselves. I mean, these are numbers we have never seen before. But when you're on social media, what's the problem with social media? You become self-absorbed. It becomes about you. And whenever you're looking inward and you're the thing that matters most, you get depressed because you start comparing yourself. Whenever you're outward and being helpful, useful,
True.
You just feel so much better
when you're of
about
service.
things because that's where you develop a sense of competence. And competence is the underlying foundation of self-esteem. You feel good about yourself because you can contribute. If it's about you, what are you contributing to?
But what if our businesses are so tied in to like us as public-facing people, with podcasts and the social media and all the things? I guess it's like kind of a twofold question. How do we navigate that? Because we still have to be effective in our jobs. And promote ourselves, yeah. But then also, too, with our kids, like we're telling them not to be on their iPads and everything, but yet for our businesses, we kind of have to do it at times, too. So, like...
Right, so you have to think of it like a business where you have certain hours. You're doing this rather than what the phone did is it took your 8-hour day and turned it into a 16-hour day where you never get away. And with your kids, the longer you can keep them off of devices like iPads and not use phones as babysitters, the better it is for them. So I know a lot of parents, their kids don't have phones, devices until they're 14. And they're like, oh my God. But that's probably the most rational approach from a neuroscience standpoint.
I'm not giving my kid, I don't care if I'm that weird mom because because it's affected me so much mentally, and my children are very sensitive. I already know that. And my daughter already has borderline like a low self-esteem. Like I'm really trying to work on the way we talk about it, and there's no way I'm giving my child a phone before 13. There's no way, and I don't care if she hates me for it. But then it's that the thing that I get nervous about is her being ostracized by her peers because then she's the only one who doesn't, or the safety element.
She's going to tell you that. She's going to tell you that as a way to manipulate you. But the fact is, a lot of the other kids' parents are the same way. And so we just can't believe that.
Right.
And God gave you parents until your brain develops. And your frontal lobes actually don't develop until your mid-20s. So, you know, the average age kids leave home in the United States is 26. And it's because their brains aren't fully developed. Right, I'm 18, I can do what I want. They're baby adults. My kids hate that. My daughter turned 20 yesterday. And I know, I just supervise, but do it lovingly. And I always remember these two words, parenting: firm. No,
Kind.
you're not having it. Fun. And kind.
Kind.
And I know that's hard for you.
And there also doesn't need to always be an explanation, I've learned. Like, my daughter loves, because she has ADHD, she absolutely diagnosed ADHD. We haven't put her on medication. I was going to ask you what your thoughts are on that. But she searches for carbs and sugar because it helps raise her dopamine. And we sometimes give her a little bit of ice cream, but then we say no, and she'll fight and fight and fight and fight and fight. And I've learned that I don't need to give another explanation. I mean, I've given all the explanations that our body has different things that make us, you know, it's great for your brain, and your body needs to have different types of fuel and all that that narrative. But sometimes I can just say no, the kitchen's closed, but I can give you an apple, or I can give you
Banana or something.
Banana, whatever it is.
Yeah.
I can give you two separate things, and that's my answer. And I love you. I don't feel like we always have to explain in this day and age. We're over-explaining so much that I'm like, the answer is no.
Yeah, just remember firm and kind. But also make sure there are other times you're a good listener. Too often parents talk over kids. And if you want to be really close with them, two things: time, actual physical time. I have an exercise I do with kids called special time, 20 minutes a day. That's her time. Do something with her she wants to do. And during that time, no commands, no questions, no directions. It's just bonding. And it's hard. And turn off the phone. Like, turn it off, right? This is your time. If you do that over time, it's like money in the relational bank, and it'll protect your relationship. And then make sure, because when you have ADD as a mom, often it's like, oh, I have to say it or I'll forget it. And you can talk over people. This thing I love called active listening, when they say something, don't say anything, or just repeat it back. Give that space in a conversation, which is uncomfortable for people, but when you give them that space, you just repeat back what you hear, they talk to you. I've had so many parents go, he's not going to talk to you. He doesn't want to see a shrink, and he's not going to talk to you. I go, yeah, I know, that's hard. And I just sit there and they talk. And then I just listen, or I reflect back what I hear, and they talk more. And ultimately, you want to be the person she's talking to. Not get all of her advice for her friends because I can't talk to mom because she won't hear me. So time and listening, so important for bonding.
But then
And
they
then
ask
rules
to
are
go
good.
shopping.
Right.
They ask to go shopping and eat ice cream. So I'm like,
No. 20 minutes.
of none of that.
Right.
Yeah.
And ice cream actually, yes, can boost dopamine, but it also boosts serotonin. And a lot of people get sad, treat the sadness with sugar. And it's just a bad thing, right? It's feel better fast, but it clearly won't last. And the carbs boost serotonin in the brain. That's why donuts live, right? That's sort of an antidepressant that makes people fat, depressed, and feeble-minded, right? It's a feel better fast that doesn't last. And so she's 9?
9.
And so she has ADHD and she's 9. First thing I try is an elimination diet, just for a month.
But then she's so picky with her food
But-
because ADHD they have these weird textures.
Just for a month. See if you can eliminate gluten, dairy, corn, soy, artificial dyes, and
do that.
sweeteners. And Tana, my wife, has a cookbook called The Brain Warrior's Way cookbook. everything in there, no gluten, dairy, corn, soy, artificial
Much
sugar,
sugar.
sweetened, or sugar.
That's a
Now,
big one.
natural sugar can be helpful. I also like stevia, but if you try an elimination diet for a month, it doesn't make any difference, then certain supplements, especially
iron.
magnesium, she should have her thyroid checked, she should have her iron checked. Low iron's a very common cause of ADHD and anxiety, the combination. So sometimes iron can help, magnesium, zinc, so certain simple supplements. And if that doesn't work, you totally should consider medicine, because she inherited it. It's not her fault.
Sorry.
And the goal is never medicine or not. Like for you, we were talking about you. The goal is not, should I take medicine or not? The goal is always your best functioning. And if you function better on a little bit of a stimulant, well, God bless you. If you function better on a little bit of an antidepressant, that's awesome. In my mind, I own a supplement company. It's, let's try natural things first, but if they don't work, well, let's try the medicine, right? I mean, if you had a heart thing, you'd never go, I don't want to take medicine. If you had diabetes, you'd never go, I don't want to take medicine. Or if you had cancer, you never go, no, I don't want to take medicine. It's like, not a good idea.
Yeah, it's more just about like don't you fear that when you take something, or if you did, for me it's always that I have a great sex drive, and I don't know a lot of women like me who actually, I don't seek it every day, but I enjoy sex. I enjoy it. I think it's awesome. My husband's never said, let's have sex, and I go, well, I'm just great, thank you for the offering. And I think women, I don't know if it's hormonally or they're not connecting sexually, I don't feel comfortable with their bodies, but I love that part of my life. And the idea of taking something, I think, would make me more miserable if I had now lower orgasms, or for my job not being able to cry or feeling emotional. So I guess you try. It's sometimes maybe you just have to accept that you're always going to have to. I would love to have this idea that it can all be great, but I don't know if that's really a possibility.
Is that in fact the side effect of those drugs?
So
she's like, you like. Is that in fact the side?
SSRIs, the selective serotonin reuptake inhibitors, like Lexapro or Prozac or Zoloft. For some people, clearly not for everyone, it can decrease your interest in sex, and it can make it harder to have an orgasm. It's one of the reasons about 20 years ago I got really interested in saffron. So the spice saffron, world's most expensive spice. I started reading studies about how it helps mood. There's now 24 randomized controlled trials showing it's equally effective to SSRIs, but it's prosexual. It increases desire.
Oh no! She's like, lordy.
Oh, no.
And
Small doses over here.
Mood, memory, and sex. And we released it right at the beginning of the pandemic. I had to close my New York clinic. My dad died. I was like, so I started taking it. I would not be without it. And so for me, if you're going, maybe a little bit of Lexapro, it's I'd try Happy Saffron first.
Right.
And then if it doesn't work like you hope, I would try a little bit of Lexapro and see if it makes you not able to cry, then I'd stop it. Or if it messes with your sex life with your husband, I'd stop it.
He'd be thrilled. He would be thrilled. He's tired. He's a tired man. He has 2 small children. He's still 12 years older. He's done with me. He said he'd never have an affair because it's exhausting. One is exhausting enough. He doesn't need to. Yeah.
He sounds blessed.
Yeah.
Since we're talking about the elimination diet and all the things, there's also a big chat about grain brain and how grains affect the brain. as far as like Alzheimer's go and dementia and things like that. What are your thoughts on that? Do you believe that? Is there truth in that?
Well, I'm actually friends with David Perlmutter, who wrote Grain Brain.
I read it.
And I'm not a fan of gluten because it, in many cases, gives you a leaky gut. It makes the cells that line your gut come apart just a bit. And then bad stuff gets into your body and it can cause autoimmune disorders, especially thyroid disorders, and it drops function in the cerebellum, which is in the back bottom part of your brain that's involved in coordination. So if you're an athlete, you need to stay away from gluten.
I think my biggest issue with ADHD and perfectionism is if it's not going to be amazing, or if I feel like it's not going to be amazing, then I give up halfway through, or I don't start. And when you talk about ADHD and transitions, which I thought was really fascinating, is when people change the plan, I get very aggressive. And where does that come from? Like, what is happening in ADHD brains that means that, like, when you say you can't transition, what do you see on a brain scan that shows and proves that?
So it's this type of ADHD. So not everybody has it. The classic ADHD people, they transition all the time. They just have trouble sticking. But the over-focused ADD, they have really two separate problems. They have the trouble focusing and the trouble shifting attention. So when your anterior cingulate gyrus, so that part right down the middle of your frontal lobes, works too hard, you have trouble shifting, so you can worry, hold on to grudges. If things don't go a certain way, you can get upset. You can be a bit argumentative, somewhat oppositional. And if things don't go the way you think they should, sometimes it causes meltdowns.
Like the cameras.
Like
In audio, I can't, when our podcast audio is not well, I can't even finish listening to the show. Like, I can't even edit it. It's hard for me.
Yeah, and some of that's really good because it keeps you delivering stuff that's great, but it causes too much pain. So at what level, I want to calm it down, but not too much, right? So, for example, you want your neurosurgeon to be a perfectionist. You don't want them leaving stuff in your head. And so it's always just a matter of balancing it.
While we're talking about this, I was just thinking about, of course, seeing it on social media quite a bit, is Ozempic, right? We're seeing Ozempic everywhere, and so many of these, public-facing people, celebrities, actors are taking it. They're not necessarily admitting that they're taking it, but
Don't even need it.
they don't. Right, exactly. But what does a drug like Ozempic? What effects does it have on your brain, like negatively? Is there?
So they're actually starting to use it for addiction.
Okay.
And they find that it's really helpful because it stabilizes blood sugar, it stabilizes insulin, and that can be a really good thing. The problem is it's new and everybody's taken it. So it's sort of like when marijuana was first made legal, everybody's taken it. And now we're in this shit show that is American society. I worry, it's like, well, let's do the right things first with your diet. And not everybody does well, but I do really well on a ketogenic diet. I mean, my weight's good, my energy's good. Not everybody does, but I have a granddaughter that has a seizure disorder, and on a ketogenic diet, her seizures went away. So I've been really interested in how it helps the brain for certain people. But my preference is, can we just get you to eat right? And let's do that first. Like, for example, in 1980, Americans drank 225 calories a day in what they drank. Now it's almost 500 calories a day in what they drink, which will add 23 pounds of fat a year on your body, just that extra 275 calories a day. And it's like, don't drink your calories. Let's start there. So another sort of hit on alcohol and what, it's not just the alcohol, it's all the sugar and stuff they put in it.
And what about fasting? Because my husband and I, he says, and I agree, like during the pandemic and after COVID, he gained quite a bit of weight around his midsection. And so he started intermittent fasting. He lost weight really quickly. He stopped it because we were traveling. Now he's going to go back on it. And it worked really well for him. I did it because I was like, you know what? Like, I'd like to be a little tighter. I'm getting older. My hormones are changing. And I did fast in accordance to my cycle because I heard that was sort of the way to do it for women, because fasting for women and men are very different. And I felt like an asshole half the time. I was like moody. I felt great in the first 2-3 weeks, and then I felt like crap. So what do you think about intermittent fasting, and is it good for the body to not have, obviously you're having water and electrolytes and things like that, but not, sometimes these fasts to go from 16 hours to 32 hours and sometimes even longer. And why do men do so well on it? Because he feels great.
But it's not just men, but it's his brain.
Right.
And so I wrote a book called Change Your Brain, Change Your Body. And I argue that there are 5 different types of brains, and don't give everybody the same diet. That for some people, ketogenic diet is amazing, and for other people it makes them mean. It was on Rachel Ray's show, and we were talking about a low-carb diet, and she said, I'm surprised I'm still married because I was so evil to my husband, right? So you have to sort of know your brain. And I'm a fan of 16-hour fast, and it's really not hard if you think about it, right? Yeah. You eat dinner at 6 o'clock and you don't have breakfast till 10 o'clock the next morning.
Right.
That's not a big deal, but it's a big deal for your brain. It turns on a process in your brain called autophagy, which is self-eating, which basically means it gives your brain time to clean up the trash that built up the day before. So if you're sleeping 7.5, 8 hours, if you give yourself a break from feeding, most people handle that really well. Now, some people have ADD, have low blood sugar, they have hypoglycemia. I have one of my young stars used to get arrested all the time, and when I did a fasting blood sugar, it was 49, right? Normal 65 to 100, it was 49. Getting him to eat 4 or 5 times a day, he wasn't an asshole anymore, didn't get arrested anymore, right? Because when blood sugar goes low, you're not thinking right. You're not supervising what comes out of your mouth.
But doesn't your body, because what I learned too is that, so I was starting to get that hypoglycemic feeling because my body was when you're fasting, my body was burning sugar first. And that's when I started to get hypoglycemic. But the interesting part about it was if I went after 14 hours and a little longer, my body, I heard, is starting to burn its own fat. So when it starts to burn fat, you actually are stabilizing blood sugar, aren't you? So I didn't feel dizzy the last part of the fast, but I felt it in the beginning of the fast when my body was burning sugar before fat.
So I would just see what works best for you. And for your brain, I would worry about a very low carb diet because you'll spin more. And so, but I think keeping it balanced.
So does the diet help with, because we all have cancer cells that already exist within our body, does the diet help turn on or turn off cancer cells, and how does that, work within our system?
Well, so back to alcohol just for a second. The American Cancer Society 2 years ago came out against any alcohol because they said any alcohol increases your risk of 7 different types of cancer. So given your dad's an oncologist, you don't want cancer, right? If you can avoid it.
Definitely
So
not.
the other way to avoid cancer is get rid of sugar and foods that quickly turn to sugar: bread, pasta, potatoes, rice, fruit juice, sugar. And because sugar is pro-inflammatory, and it nourishes cancer cells. You don't want to be nourishing cancer cells, right? And yet, on average, Americans have 150 pounds of sugar a year. We celebrate with sugar, we commiserate with sugar, and I'm like, why are we doing this? It's nuts. When you actually just sort of step back and look at how we celebrate with kids, I want ice cream. And I remember my daughter, it's hard growing up in my family, but we went on a really strenuous hike when she was 7, and her mother said, "You're a tough cookie." And she said, "I don't want to be a tough cookie. I want to be a tough red bell pepper."
Now that is good.
Fun. Yeah.
That is good teaching.
Yeah. How do I get my kid to say that?
Exactly.
You play a game with her. Is this good for your brain or bad for it? So we called it Chloe's game. And I would go, "Avocados." And she'd go, "2 thumbs up, God's butter." And then I would say, "Blueberries." And she'd put her hands on her hips. She has red hair like her mother. And she'd go, "Are they organic?" Non-organic blueberries hold more pesticides than almost any fruit. I'm like, "Of course they're organic." She goes, "God's candy." I said, "Talking back to your redheaded mother." She goes, "Oh, very bad for the baby."
It's just hard to make them not feel guilt and shame, because that, I had an eating disorder when I was younger, and, my mom even said this. She's like, we just didn't know in her generation. Like, she would talk about calories and diets and look at her body and say, well, that's not good for you, and that's, so it's like, it's really about the narrative of how we explain what is, because I hate to use the word bad, and I hate to use the words fat and skinny, so it's just trying to change those words to make them feel.
But it's healthy for your body, right? If your body is too thin, that's really bad for your brain. And if it's overweight, that's not good for your brain as well. So what's healthy? And I sort of like calories because people have no clue. 20% of kids are overweight or obese, and they just have no clue what they're eating. So I like for them to know without it being an obsession.
Right.
But I always say calories are like money, and if you overspend, you're going to get bankrupt. Your health is going to get bankrupt. But you have to spend enough, or you can't live.
Right.
And so, what's a healthy range? And I think when you phrase it about, is it good for your brain or bad for it, it's just a better message, I think. I eat so that I can be effective and live. I don't live to eat.
We kind of tried to make a game of it. Not that it works all the time, but it's Eat the Rainbow. So we're like,
I like that.
Do different colors like on the plate, and if it's maybe a veggie and a fruit, and sometimes we obviously will give her like dessert, but I don't know
but you have a child that's very, my 4-year-old will eat sardines. So like you have a child like that. So I think it's way easier to teach a kid who already is open to, she eats everything. My second child, my first one eats bread. Bread or a version of bread, or she won't eat. She'll eat. That's not true. She'll eat hummus and carrots and smoothies and stuff like that. But it's when we go on vacation, it is a fight. It's either no food or a bread roll. She won't eat.
But if you give in, then you've just taught her to be upset in order to get her way. So the rule in my house is this is what we're going to have for dinner. You can eat it or not. It's completely up to you. And I don't buy crap, so it's not an option. If they're in the store with you, it's like, come on, ice cream, cookies, soda. No, I don't spend money. So I adopted my 2 nieces. And they're now 18 and 13. So we adopted them because their parents couldn't stop being bad parents. And the first time we went on our grocery trip, I'm like, good news, we're going to have lots of food. Bad news, I don't spend money on things that'll hurt you. So It's the education. But the
Right.
18-year-old now just got a full scholarship to UCLA, and she's doing great. Not without vulnerability, right? Caught her vaping and grounded her for 6 months because I'm like, you have addiction in your family. There's like, I'm not okay with this. So,
Yeah.
and that was painful for her and for me because I like to be the nice person.
Yeah. I always think punishment or discipline, although we don't punish, we solution orientated and we consequences. We really believe in consequences. If I keep telling you to do that to your bike and you lose your bike, you don't get a new bike. Consequence done. Like I don't believe in like then, taking ice cream. It's something that's not to the thing itself. So we really believe in that. But it's hard to do it because it feels worse for you than it does for the kids.
But your job isn't for them to like you.
I know, but I
Your
want them
job.
to so much because I love them.
But they will like you
love
more.
them so much.
So my wife has this wonderful enmeshed relationship with our 20-year-old. And when she was 7, we always said she's either going to be the leader of the free world or the leader of a gang. And she
You
would
say about a 4-year-old, I'm like, oh.
she would spend hours sitting with her trying to get her homework done. And then she took a program that I dearly love called Parenting with Love and Logic that is so smart. And she learned, I've already done 2nd grade. So she told Chloe, I'm never going to ask you to do your homework again. I've done 2nd grade. And if you decide not to do it, it's on you, and you're going to have to deal with the teacher. And the teacher will be disappointed, or you won't get to go recess. Completely up to you. And if you really don't do your homework, you're a nice child. You'll make new friends when you repeat 2nd grade. Whoa. She stormed off. I never said I wouldn't do it. I'm just not going to do it now. She came back 20 minutes later, and Tana never asked her to do her homework again. She holds the anxiety for it. And she's now a 3rd-year student at Chapman, and she's just amazing. And oh, by the way, if she forgot her homework, Tana wouldn't bring it to her at school. If she forgot her sweater on a cold day, or she argued with her mother and say, I'm not wearing a sweater today.
Been fun. I do that with my 4-year, like even my 5-year-old. She's like, I'm not gonna do it. I do sneak it, like, but I'm like, okay.
And so she only forgot her homework once. She only forgot her sweater once. She only forgot her lunch once, and then she learned, right? But too often, parents do too much and create incompetent people because you're not teaching them to solve their own problems. And we love them so much, we don't want them to suffer, so we create entitled kids that don't feel good about themselves.
And we also don't let
and that's a problem if you have a famous mom. Because it's like, let's do.
And also we don't give them space to be disappointed
Right.
and upset and angry. Like when my daughter's angry, I'm like, I see you're angry. Oh, that's a big emotion. I see you. I love you. I see it and I get it and I'm here. And so like, especially my husband's 12 years older, he would see anger as something that was very dangerous to him and like, well, don't yell and don't be upset. And I'm like, we're in the house. Like she's allowed to be frustrated. She's allowed to feel those feelings. And I think we negate so many of them as when they're children because we're like, they make us feel uncomfortable. Anger is it's not a primary emotion. It comes from
It is,
fear
but you also
or-
want them to be appropriate.
Well, she's not going to
I have rules in my family. I have
She's
rules.
not saying like F you, mom. But if she's mad about a thing and she's like, that person was just being a jerk, and I'm like, yeah, tell me about it.
Do I like the tell me about
Yeah.
it so she can feel like she can talk to you.
Yeah.
But I like rules. Tell the truth.
Yeah.
We treat each other with respect.
We do
Put
that
things
team.
away you take out. One of my favorite rules. Or do what mom or dad say the first time.
Yeah.
Because if you tell a child to do something 5 times, your chance of abusing that child just went way up.
Interesting.
And we teach people how to treat us by what we tolerate.
That's a good point. That's a good point. How do you tackle these sort of problems? Like if it's a repetitive behavior almost.
Give me an example.
Like if she doesn't pick up her clothes and like, we've said, please, pick up, you grandma and grandpa are coming. Can you please clean your room because your cousin's coming too and you guys could have a fun play date in here and, please do
So
that.
one, too many words. It's like, pick up your room. And if you don't, here are the consequences. And if I have to do it, that's going to drain my energy. And I'll let you know how you can get my energy back. So that just and when you don't know what to do in the situation,
Right.
it's like there's going to be a consequence. I'm going to think about it, and I'll let you know, which raises their anxiety.
But I have a question that might be an opposing view because I listened to this on a podcast. What is it about her room being clean that triggers you so much? And I'm just saying, I'm not saying that we have to live in a pigsty and our house is immaculate. So because my husband is so crazy about cleanliness, but there also is a trigger within us that like if that person walks in and there's stuff, and how messy is messy, right? If it's like a complete pigsty, maybe we're talking about something different. But if there's some clothes in the corner, what is it about you thinking that that person's going to see it and be like, oh, Roxy's a slob,
right?
Or like her child, like is there a trigger within you that really triggers that thing in and of itself? Does that make sense?
I think it's like also like taking pride in your surroundings, and it's just kind of like take care of your things. If you want, because every time we pass by a store, she's like, I want a new toy, I want a new dress. And I'm like, but you have so many already at home.
How old is she?
9.
Yeah.
You have so many at home already that you don't take care of, right?
Train them.
Oh, yeah.
Phoenix broke her iPad. She didn't get a new iPad.
But if you think of the employees that have messy desks, they don't do as well as those.
Do they have ADHD, doctor?
Yes, I understand.
This is a problem for me. I married a clean freak for that reason alone. My house is immaculate. Not for me. He cleans my closet for me. I give him sex. I give him sex. He cleans my closet. It's a perfect match.
There you go.
So my son has ADHD. He and I actually wrote a book together called A Teenager's Guide to ADD. And like I would clean it with him on Sunday. And by Sunday night, it's like there was an explosion in there. And I hired a professional organizer for him because he wasn't listening to me. And I had her come back like every couple of weeks for 6 months. And he is the most organized. It's it's a skill to learn.
Right.
So that when he went in the Army, because later he went into the Army, didn't bother him at all. He had developed a skill that was not natural to him. And you just want to go, what's going to help them in their lives? A good relationship with both of you, that protects them from mental health problems, right? Bonding is really important, but then clarity of rules.
Clarity. So boundaries within, letting them explore, but within boundaries.
Yeah.
Because sometimes...
Within acceptable
Right.
boundaries, right? You let them make as many choices as they can within what's acceptable.
What's acceptable? What about, why are you telling me what to do? You're bossing me around. That's like a key
I'm
phrase.
Mother.
Right.
It's like I'm your mother.
Right. You can say that then, right?
God gave me to you until your frontal lobes are developed. And that's not for a while.
Okay, so as we're wrapping up, because I know we don't have that much time, I just want to ask this one of the final questions is I did want to talk because you had said in the beginning of this podcast that mental health can actually be so many different things that people aren't looking into before they just, again, go straight onto medication, right? It could be like low thyroid, we're talking about hormones. Women, I feel like women especially, we are like in perimenopause. I mean, I just turned 40. I cannot believe it. Don't tell me I look 40. I just turned 40 and I know that my cycle's changing. I feel like things are changing. Even mental health things, I feel like are a little bit harder for me. So what are things that we can get checked before we just go straight onto like, again, like you said, if medication works for you, that's great. But what are some other things that show up as depression and anxiety that maybe isn't it?
So in my books, I have an acronym called Bright Minds. You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. So Bright Minds, B is for blood flow. Are you doing anything that hurts your blood flow? Alcohol, marijuana, nicotine, caffeine, all constrict blood flow to the brain. Ours, retirement and aging. The older we get, the more serious we need to be about brain health. Also, is your ferritin level, your iron level, too high, accelerates aging. If it's too low, goes with ADHD and anxiety and insomnia. So getting your ferritin level checked is critical. The I is inflammation. Do you have too much inflammation in your body because of the gluten, or you have a low omega-3 fatty acid levels? I think all of us should be taking fish oil, or we actually make a vegan form of omega-3s from algae. G is genetics. People go, oh, I'm overweight because my family's fat. And I'm like, no, I come from a family of fat people, but I'm not fat. Why? Because I know it's my vulnerability and I work hard to protect it, right? So genes aren't a death sentence. What they should be is a wake-up call. The H is head trauma, a very common cause of psychiatric problems. And nobody knows about it. It's that car accident, that fall, that fight that hurt your brain, and then that's why you're depressed. Or why you have Irlen syndrome, which is very common after a concussion. The T is toxins, and we talked about alcohol, marijuana, mushrooms, but also mold. That mold toxicity can totally make you feel brain fog and depressed. The M is mental health stuff, and there is how many adverse childhood experiences did you have? We did doing this huge study on ACE scores, adverse childhood, on a 0 to 10. How many bad things happened to you? My wife's an 8. My nieces who I adopted are 9s. Lots of things. So we need to clean that out or you're going to struggle. The second I is immunity and infections, and now COVID's coming around. Again, COVID is just bad for the brain. It causes this inflammation bomb, but also things like Lyme disease, totally major cause of psychiatric problems. And then the N is neurohormones, and you just turned 40. What a lot of women don't know, I'm turning 70 next year. I have no empathy. I have no empathy for you at all.
Your skin is gray.
I know.
Okay, but what women don't know is progesterone, which is the female anti-anxiety hormone. It drops 10 years before women go into menopause. Wow. And so at 40, women often become a little meaner, they drink a little bit more, they have more insomnia, they come, and now they're on Lexapro, Xanax, and Ambien, and I'm like, no, just give them a little progesterone. So day 19 to 21 of your cycle, get your hormones checked and see. And if progesterone's on the low side and you're tired of the anxiety, take a little bit of progesterone at night and see if that won't help.
It's funny you say that because when I was pregnant, I felt amazing because so much progesterone. And I actually, after I ovulate, I feel terrible until ovulation. And then after I ovulate, I have this week of bliss. And it's because my progesterone starts to raise just before it drops before my period.
So working with someone to optimize it. See, whenever I look at a lab test and I look at what's the normal range, in my mind, I'm always going, what's the optimal range? What's the optimal range for me to help my patients feel their best? And so I would look at it. And if it's in the bottom third, for example, even of normal, I'd try a little bit of progesterone and see if we can't get bliss 3 out of 4 weeks a month. That would be worth it. And the D is diabetes. Is your blood sugar high, you're overweight. I published 3 studies that shows your weight goes up, the size and function of the brain goes down, and with 72% of Americans overweight, 43% of us obese. It's just a disaster. And S is sleep. So those are the other things I sort of think about.
And what about the like the anxiety portion of like perimenopause and menopause? Is that something that becomes more pronounced during that time?
It does, but balancing hormones can be so helpful for you and the people who love you.
And synthetic hormones, does that mean you're it depends on the person, or
Depends on how you test, right? It also depends on other things like your breast cancer risk and so on. But my wife says the 100 milligrams of progesterone she takes at night keeps her off the 6 o'clock news.
I like
well,
that.
on that note, we're going to. Your poor wife is like, I am the end of this podcast. Thank you so much. I mean, so much food for thought.
Yes,
and
so much.
You need to scan your brain. Figure out if
I
there's
know.
a brain. Just kidding.
I know.
There's a brain.
No. I do need to like see what's happening in here because I feel like for a long time I've kind of pushed it under the rug, but
Yeah.
it would be helpful.
Yeah. And where can people, obviously, I mean, all your social media is so massive right now, but also where can they read your books, and do you have like one site that people can go to for that?
And go to amenclinics.com, amen like the last word in a prayer, clinics.com, and learn about me, learn about our clinics, and all that we do.
And people can come and see you, just people that want to come
Then
see
come
you.
to one of the clinics for
One
sure.
of the clinics. We can come see you. He just smiles. He doesn't say yes or no. He just smiles.
He's just listening.
He's
Right?
just listening. Well, thank you guys so much. We are Women on Top Official on Instagram.
And Women on Top podcast on Facebook and Women on Top official on TikTok.
And don't forget to rate, subscribe, and comment. And I am Tammin Sursok.
And I am Roxy Manning.
And we are
Women
Women on
Top.
There you go. Thanks, guys.
Yes, thank you.